Great, okay. Let's make a start. We've slightly delayed the beginning because one of the sessions ran over. So that will give us a bit of a latitude, but we'll run the session for no more than an hour and a half. But this, for me, is a very exciting session. It's looking at rural water finance, as it says up here. And I think two of the exciting and interesting areas in this space, one in terms of government engagement with the ideas we've been talking about professional service delivery models. So it's been discussed in a number of sessions, so I'm not going to rehearse what you've heard already, but the extent to which governments can engage in this space. And then secondly, on the finance side, we know there is an enormous financing gap. How do we think about how we can address this going forward? So those are the two broader themes that I want to get into. We've got some excellent speakers who will come up and help us guide us through these conversations with some of the latest work and thinking in this area. So to put everybody on the hook, I've got three objectives for this afternoon, and I will see how well we do in achieving those. But firstly, to characterize the conditions for an experience of government funding for rural water supply. And that will cover the first half of our session. So we have two government speakers who will come up and share their experience and their insights in this area. Then we'll have a panel session that will follow that will look at pathways to increase long-term funding from non-traditional donors. So if there are donors in the room, whether they're Dutch, UK, etc., they will all say the same things, that bilateral, multilaterals don't have sufficient funding for where we stand at the moment. There may be efficiency gains, and I think there are probably quite a large efficiency gains that we can make, but how do you attract in new funding into this sector? So we'll have a conversation around that, and that will hopefully help us to get to the third point in terms of the sort of transition to more sustainable models that particularly target reducing social inequalities. So, conscious of time, I'm going to just say two words about our speakers. Mr. Amadou Chowdhury, you've heard from before, so he's just going to fill in a few more gaps about the Safe Pani work and the government's engagement, so he will speak first. And then this will be followed by Mr. Athik from Chief Additional Secretary from the Government of Karnataka in India, and he will talk about the Jal Jeevan mission, which I'm sure many of you will be familiar with, which is an amazing program of work trying to provide piped water to over 1 billion people in India, a staggering program of work. So we're very excited to hear from Mr. Athik, and then we'll go into the panel session. So at this point, I'll hand over to Mr. Chowdhury.
Thank you, Professor Rav. Good evening, good afternoon to you all. Thank you for having me here. Actually, we'll be talking on the financing of water supply in the institutions, especially in the schools and hospitals, health and centers. You know, we have a lot of challenges for ensuring safely managed sanitation in Bangladesh. There are different initiatives, different models, but recently with the support from REACH program, we have actually come out with a very good model for our institutions and health centers. I will be discussing on the financial side of our initiative. So you know, Bangladesh may be a very small country in the perspective of the geography, but the contextual aspects are many, especially the hydrogeological issues are more diversified. And we have actually a lot of big rivers, and we have a long coastal belt. frequently we actually encounter the natural disasters like floods, cyclones. So these are big challenges in Bangladesh. During monsoon, actually, we many times there are floods. So these disasters actually they are just sometimes they are destroying our facilities, or they are hampering our facilities, and many times we have to rehabilitate those facilities. These are a big challenge. So for sustainable water facilities and water supply, we will face a lot of problems. So these are big challenges, and we're trying to address those challenges. As I already mentioned, the coastal zone faces multiple safety threats, especially in our coastal belt. We have the problem of salinity. This is a big problem, and both underground water and surface water, actually, we have the same problem. And to come out with solutions, we actually we have to adopt different technologies. For example, reverse osmosis and also managed aquifer recharge, and also ponds, sand and filters. These are different technologies we are trying to adapt, and these are the technologies actually, these are very difficult for the communities to actually, they face difficulties for the operation and maintenance of these technologies. For this, actually, as we were talking in the morning, we have to have professional service delivery system, because our communities are actually they are actually not able to manage, or they are facing problem with the operation and maintenance of these technologies. We have talked a lot on those issues yesterday and also in the morning today, and we actually are successful in that. We are now providing almost 99% water from improved sources. This is definitely a big success, but if you talk about the safely managed or safe water, in that case our achievement is 60%. So this especially we are having problem with the E. coli or something like that. These issues actually are addressing, especially through the project of Safe Pani. We are addressing these issues in the institutions, and also for the communities. We are also with, as I have already said, we are using the technologies to improve safety of our water. So Bangladesh water governance, especially for the water supply, local government division under the Ministry of Local Government, Rural Development and Cooperatives, they are solely responsible for the water supply issues. And we have different agencies. For example, we have local government, under the local government division, we have Department of Public Health. They are mainly responsible for the water supply of the rural areas and for the small towns. But for the big cities, we have WASA, Water Supply and Sewerage Authorities. And there are some other ministries. Actually, we are working in a coordinated way. For example, for the management of the water sources, there are another ministry, the Ministry of Water Resources. So we are to work in coordination with the ministry for better water, integrated water management. So this definitely are challenges, but we are trying to coordinate with the ministries for better and integrated water quality management, and also the water sources are being managed, and they are also managing our rivers. They are preparing embankments, barriers, barrages. So there are issues of coordination for better water management here. And regarding water policies, actually we have some important policies for water and sanitation, and we are regularly updating our policies. And policy support branch of the local government division actually responsible for updating these policies, and we are trying to align our policies with the SDGs and also with our long-term visions. Bangladesh have, have long-term visions like 2041. We have a target to achieve the higher income status by 2041. So we are actually aligning our policies, and as we are developing actually our migration, the people living in the urban areas are increasing. So this is a big challenge. So accordingly we are planning and we are updating our policies. Save Pani, as I have already mentioned, this is actually a very important initiative for Bangladesh, I will tell, I would say, because actually we are facing problems with operation maintenance, and we are not actually finding very good solutions, very cost-effective solutions. And Rich conducted one survey in 2 districts of Bangladesh in 2017, and based on their research finding, they actually come out with some very good model that we are calling Save Pani model, and they are actually engaging one professional service provider, and that is Haiswa. In morning we have discussed, and Haiswa is actually taken the responsibility to maintain the water sources, and also the main issue is here just maintaining water sources, rehabilitation, also some routine repair and maintenance, and also the main issue is the quality, ensuring the water quality. This is the big issue, especially in our rural areas. There are small water system, hand pumps. Water apparently look very good, but there are some contaminants, both E. coli and other fecal contamination, and also some metals, arsenic, manganese. But these are the things we are not actually addressing. So REACH came out with a very good idea that we actually our community-based operation maintenance actually they are failing to identify these problems, especially the water quality problems. So the model that actually REACH is giving, they are actually finding out with result-based monitoring system, and the operator is being paid based on the findings of the result. So this is a very good idea, and we are really going along very nicely in the piloting. Our experience is very satisfactory, very satisfied, and definitely we are trying to scale it up. We are planning to scale it up. In this project, actually, there are for monitoring, there are 2 committees. At the central level, we have a steering committee headed by the additional secretary of the ministry level, and there are representatives of different ministries at that committee. That is the committee at the ministry level. And in the district level, we have another committee that is headed by deputy commissioner. And there are representatives from different local government institutions. Also, there are agencies of the district level, agencies of the ministries. They are member of the district committee, and these 2 committees are actually doing the monitoring part, and they are also looking at the qualities, and they are also looking at the results that HISOA or the operator is performing. So with this sort of arrangement, the piloting is going on very nicely, and it will end in December 2023. And from 2024, January, we are actually going to scale it up at the district level, and at the district level, all the sub-districts and two municipalities will be covered, and all the educational institutions, especially schools and our madrasas and healthcare centers, they will be included. There will be 1,600 water points, and also the main issue here is we are trying to save the funding. Actually, initially in Bangladesh, we didn't have any dedicated fund for the operation maintenance. We actually we have taken a lot of big projects for facilities, for building water facilities, sanitation facilities. But at the end of the project, in most of the cases, this actually these facilities didn't function. There are we engaged a lot of money, but at the end, after 5 years or 7 years, actually these facilities actually didn't give us a very good output. Our outcome is very, very unsatisfactory. So this was the biggest challenge, though there was a inefficient use of our resources. Now, with a very small amount of money, we are being able to maintain in a sustainable way of our water facilities. So in the district level project that we are actually working with now, there will be 7-year projects, and total $3 million $300,000 is the total cost, and 50% of that cost will be borne by the government of Bangladesh. And this is the first time probably the government is investing in the operation maintenance. So this is the big achievement. So we are actually giving the importance for service delivery, not just developing or building good big facilities, but our main target is to deliver services to the people, citizens. So this is the main, I think, main intervention here. The main intervention, we are shifting from the infrastructure development or taking, we need big infrastructure, but the more important issue is what services we are getting from those infrastructure. This is the main issue, and from this project we are learning so that with a small amount of money we can have a very good satisfactory result. So this is the main output or say learning from this session, and definitely with maintaining qualities, water quality. This is the main targets for safe water supply. We need to maintain the water quality. The result-based monitoring system, payment system is there, and it is working well. I hope definitely as we are satisfied, and definitely it will work in future also when we go for scaling up. As I mentioned, estimated cost less than $1 per person per year is being spent for these services. So this will help in many ways. For example, actually in our schools, this is not the responsibility of the school of an educational institutions or health clinic to actually maintain the water systems. Their mandate is in a different place. They has to educate, give education services, health services. So we are allowing them to concentrate on the basic roles and responsibilities rather than being engaged with other purposes. This is another important issue, and here actually another issue is we are not excluding anyone, because in schools, in the rural schools, we have students from all types of, say, families, poor families, and also well-off families. They are actually attending in schools, and they are taking service from the healthcare center. So there is another issue of not excluding anyone. We are including everyone, because in schools there are representatives from all corner of the society. So this is another issue. So this is a very good example, and we are really, the government of Bangladesh really appreciate this sort of initiation, this sort of initiative, and we actually thank REACH and Oxford and also our donors, FCDO and UNICEF, for coming up with such innovative ideas. And I really believe if our cooperation continues, definitely it will help us to scale up this sort of models in the rest of the districts. We have 64 districts, so now we are thinking of one district, then we can scale up this sort of in the other districts. Definitely this will have a very big impact in future. So the final words will be, we really want to go with this sort of initiatives, and we actually want to continue this sort of collaboration in future, and which will definitely help help to achieve our targets of cleanliness and sanitation. This will definitely have a very big impact. Thank you.
The back there.
Hi, thank you. My name is Minhaj from Drinkwell. We work in Bangladesh. And my question is, this is really exciting. And I always hear at water conferences how we're behind schedule, SDG 6 is looming. So as you think about how you want to scale it up, what are some of the ways you can, instead of going from like one district to a second to a third, kind of quickly, if there's success in this model, think about scaling to meet the national targets?
Can I respond?
Please.
Thank you. Thank you for your question. And this issue we are discussing in the morning with Robert Hope. Actually, we are thinking, this is in the thinking process. We are thinking when we will start the piloting in a district level from January 2024, and after a very smooth initiation or just very good progress, say 1 or 2 years, we'll then definitely take initiative for starting in other districts. We'll not wait until 2030. Definitely, we should not. If we can run the district project smoothly, and within 1 or 2 years, based on our initial learning of the district level initiative, then we'll definitely go for. If everything remains in our favor, definitely we should try in other districts. Definitely. Thank you.
Are there any other questions? We can possibly return to this later. So, okay, well, let's move forward. Thank you very much indeed. Were we able to show the video? We are. Is there some magic behind that at least? Do I need to do something? Okay. Okay, so that is, oops, hang on. That provides, I think, an introduction for Mr. Atik to come up and tell us more about this amazing program. Please take the floor.
Thank you, Rob. Good evening. My name is Atik. I'm in charge of finance department in the state of Karnataka in India. But before this, last 5 years, I have been in charge of rural development, which included rural drinking water supply and sanitation. And Jal Jeevan Mission is was one of my responsibilities. And then I'm going to speak about Jal Jeevan Mission, which means Jal is water, Jeevan is life. So it's a mission for providing water, which is the source of life. So I have to operate these slides. Yeah. So Jal Jeevan Mission, in India, we have launched this mission in 2019 with the objective of providing 55 liters per capita per day of water of acceptable quality to all rural households. So the outcomes that we expect from this is to provide adequate quantity of water through functional household tap connections, which means that we have been having pipe water supply in India for a long time, but individual household tap connections were few. At the start of the mission in 2019, about 16% of the rural households. India has about 193 million rural households. Of them, about 16% had tap connections. So the objective is to go to, by 2024, reach 100% of the households, which means that we have to provide nearly 170, I think a little more than 170 household connections. And this we have adopted through a community ownership of the rural drinking water supply and sanitation infrastructure. And this mission also has a focus on grey water management, because once you start supplying 55 liters of water into the village, about 75% of that water actually comes out as grey water. So that grey water again will have to be reused. So this is the, and in addition to providing tap connections to all the households, we also have the aim of providing tap connections to all the schools, all the daycare centers, which we call as Anganwadis, to hostels, hospitals, etc. We have also taken up a mission to do an information and education program in order to promote community ownership and then promote the knowledge about use of safe water. And this, of course, has the other objectives of reducing school dropout, etc. So that's the overall picture of India. But coming to my state, India, as you know, is a federal country, has about 30 states, and Karnataka is a state in south of India. And when we started the mission, we had, Karnataka has about 10 million rural households. Of them, 2.4 million households had drinking water supply connections in their home in 2019. So in the last 4 years, we have reached from about 24% to about 70%. Today, we have about 7 million households with the drinking water supply connections. So about 4.5 million household connections have been provided just over in the last 4 years, 2 out of which were actually COVID years. So how do we finance it actually? This is a federal government's program which is taken up in partnership with the state governments. So basically the government of India provides 50% of the funds and the state government provides matching 50% of the share. But once the schemes are built, the operating of these schemes is the responsibility of the state government, which in Karnataka we do through elected village governments called panchayats. And we also aim to have an operation and maintenance policy wherein the community takes over the responsibility of maintaining these systems, and then they fund that finance their O&M through cost recovery from the users. And we are in the process of imposing, of levying water rates on rural households, and aim is to see that at least significant portion of O&M is covered by water charges that we collect from the families. So we have actually two broad systems which we follow. Number one is called a multiple village water supply schemes, which is basically we tap perennial rivers and reservoirs, and the second one is a single village schemes which basically use bore wells. So in Karnataka, we have, the state has a population of 7.4 million people, out of them about 4.5 million are rural. And it consists of about 28,000 villages. And of these 28,000, in these 28,000 villages, we have so far approved about 40,000 works costing about $3.6 billion. And we have already completed works in 7,400 villages, and they have 100% tap water connections. Works are ongoing in 20,000 villages, and works are yet to begin about 861 villages. Over 120 river water based multi-village schemes have been approved, again at the cost of about 3.85 billion. Then the village schemes in 3.85 billion, and multiple village costing about 3.6 billion. So about 7 billion worth of investment has been approved, and works are ongoing. So where we have been, traditionally we have relied on bore wells, groundwater, but groundwater is unreliable and it suffers from quality problems. It has contamination, particularly in Karnataka we have fluoride contamination, we have nitrate contamination, we have high TDS, and therefore our aim is, and also because of the declining groundwater tables, the bore wells become unreliable sources. We have been making investment in bore wells, and once the bore well source fails, the entire village water supply system becomes unreliable, and therefore sustainability of investment comes into question. So what we have done is that we have now tried to move towards surface water based schemes. So we have good river water systems. So wherever we have river water systems, we have a perennial river with a reservoir. We go to the reservoir, we tap water, and we design a multi-village scheme. And each multi-village scheme can serve anywhere between 10 to 1,000 villages. And these are utility scale schemes which consist of various components, which I will just talk about it. And then these multi-village schemes take water, bulk water to the entry point of the village. And then from there, the village community takes over, and within the village, in-village water supply is provided through retail schemes. These are the two schemes. Multi-village schemes, the components are at the headworks, we have a intake well, a jack well. Then we have a very large treatment plant. Some of our treatment plants that we have built range from a capacity of about 50 million liters per day to about 200 MLD, 200 million liters. Such large treatment plants are provided. From there, the pure water is pumped to various master balancing reservoirs, zonal balancing reservoirs, and village overhead tanks. And at the village level, we have single village schemes which depend on bore wells, and they also have an overhead storage tank and a distribution network. We have separated the two schemes. One set of people are implementing the bulk water supply schemes, which are called as MVS, multi-village schemes. And in-village water supply schemes are built by the community at the local level. So recently with Uptime, we shared some data, and then we have started analyzing the data in terms of service levels. I'm just sharing the result of one particular village, and we found that although the standard is to provide 40 to 55 is to provide 55 liters of water per day per capita, we find that large number of water points have actually oversupplied the water. So we are now actually in partnership with Oxford University and Uptime. We are using this data and then subjecting it to detailed and rigorous analysis to come up with service levels, to understand exactly how we are operating these systems. Our large multi-village schemes also we are implementing SCADA. SCADA is that supervisory control and data analysis, and this SCADA throws up a lot of data. What we found that this data is being generated is not being used properly. So we are now looking to subject this data to detailed and rigorous data analytics so that evidence is produced, and particularly in the form of a consumable where we can consume the data at a senior level, where we have dashboards where the operating managers, the executive engineers, and even the commissioners of water supply can take a look at as to how we are doing in terms of the systems that we have designed. These systems are very capital intensive. They require a lot of investment. Our anxiety is that once we make this investment, we need to make sure that the investment sustains through a very viable, active operation and management systems, for which data is very important. We are collecting the data, but we need to consume the data as well. But one of the most important stakeholders in drinking water supply is the community. In India, we have panchayats, which are basically village elected governments. Karnataka, in my state, has a very vibrant system of panchayats where the elected local bodies are given the responsibility of maintaining drinking water supply systems. Once we build these systems, we hand it over to the community. And in fact, our scheme has a design that the in-village water supply works will have a 10% of capital cost will have to be contributed with the community. So community contribution is there so that they have a stake and then they get involved. So the panchayats, as a subcommittee of the panchayat, we constitute a village water and sanitation committee, which is given the responsibility of overseeing these systems. And these committees and the panchayats approve village action plans. We involve implementing support agencies, which are typically NGOs who do promotional works. And the panchayats also do water tariff collection. And they are expected to pay for bulk water, which actually we are trying to promote, and we are still not there, but we are working towards that. And water quality is the most important thing, and therefore we have a two-tier water quality system. One is that we supply FTKs, that is test kits. It's called field testing kits. So field test kits are given, the simple test tubes and reagents are given, so that, and we train frontline women village workers and to test this water, and then they test water, and then they share the report with the village as to whether the water is safe to drink or is there any contamination. So post implementation, we have like I already mentioned that the community plays a very important role, and then we again have a two-tier system where the bulk water supply systems would be managed through a private contractor by the government, and the government hopes to collect bulk water charges from the panchayat, and the in-village infrastructure will be are done by panchayats. So we have panchayats at the grassroots level. We have district water and sanitation mission at the state level, district level, and we have a state water and sanitation mission at the state level. In Karnataka, we have gone in for metering of each and every connection, because metering of rural water supply connections is something which is not a practice in India. Even household tap connections, etc., even those have come during JJM, but other states are not implementing. But we thought we should bring in discipline, and water is scarce, and Karnataka suffers from water shortages. So we have implemented meters, and then hopefully we have first implemented the meters, and then we will start thinking about how to read them and how to further use that data, because as of now we are not doing volumetric billing. We do a flat rate, but our aspiration is to go in for a volumetric billing. Once we have the data, our policy is that the basic water minimum standard of 55 liters per capita per day will be provided at a flat rate, and any usage beyond that 55 liters would be charged at volumetric basis. That is a policy that we have designed, and we hope to implement it. It will be a slow process because there would be resistance, but we hope to take the community and the other stakeholders in confidence and then take them and promote the use of water in a prudent fashion. We have state quality monitors for overseeing the quality of implementation. We have national quality monitors. We have a system of regular surveillance of quality of implementation of the work. We have trained the frontline women workers to test water, like this lady who is doing in this picture. And then we are focusing on collecting tariff. So this is the supply of water through the systems. But at the same time, we also need to look at conserving water and then ensuring that our water bodies are rejuvenated and our groundwater is recharged. So therefore, we have taken up a very large scheme, which we call it as Amrit Sarovar, which is in which we have taken up revival of tanks. We have a National Employment Guarantee Scheme, Rural Employment Guarantee Scheme, which promises 100 days of employment to any unskilled employment to anybody who comes forward to work in villages. So we're using that employment guarantee programs to rejuvenate water bodies. This is the picture of one of the tanks that we have rejuvenated. So as of now, we have taken up around 4,500 such tanks to be rejuvenated. The idea is that rainfall, particularly with climate change, etc., because the number of rainy days are few. In Karnataka, they may range anywhere between 25 to 50 rainy days. And we receive an average annual rainfall of less than 900 millimeters. So if we promote storage, we have a network of tanks which have deteriorated over the years. So we are now taking up a drive to rejuvenate the water bodies that we have so that the groundwater tables are increased and reliability of supply of water even in summer is assured. So in the last 3-4 years, we have measured and we found that the number of water-starved blocks, which we call it overexploited blocks, has come down from 233. Out of 233 blocks that Karnataka has, 184 blocks have shown improvement. So, so we have basically, on the one hand, we are trying to conserve water, rainwater, by promoting a series of water conservation structures through a different programs called National Rural Employment Guarantee Schemes. And on the other hand, we are building infrastructure to provide household tap connections to each and every household. And a large amount of investment has gone into it. And today, since financing is the subject and how do we finance it, drinking water supply, rural drinking water supply will have to be funded by the state. Private sector funding will not come in. So therefore, Government of Karnataka, Government of India and the state governments have taken up this task to fund it. So a very large scale resource is being mobilized. So what we are doing is that we are committing the resources from the state and then we are trying to raise these resources from financial institutions. We have a financial institution called NABARD. I have taken loan from them. I have taken some loan from the World Bank, and Government of India also has borrowed from the World Bank. But basically we are borrowing resources from multilateral sources as well as the domestic banks and implementing it and putting that money into this, and private money etc. will come hopefully later, but as of now we are it's a 100% publicly funded program. So yeah, I think that's it. So thank you.
You want to stay there? Okay, can we invite the audience for questions for Mr. Atik? Do we have any questions? Michael?
Thank you, Michael Rouse. It's probably the best news we've heard this week. It's a very fantastic achievement. Can you tell me how widely that's spread across the other states of India?
This is a national initiative, it's a national program. It's being implemented in all the state. The performance of states varies. But overall, the average coverage of tap connections in India has increased from 16% to 70%, which means if average is 70%, then many states have reached 100%, 90 to 100%. A few states are lagging behind at the rate of, they have reached a coverage of 40 to 45. But overall, we see that every state is making effort to reach, to increase the tap connections. I think the coverage of this kind of program is quite widespread.
Okay, we've got two questions here, Sonia and Arko. Maybe we sort of have a round of questions here, so do we have a second mic? Sonia, please.
Yeah. Thank you, Mr. Atik. That was really, you explained this very well. My question is, as you mentioned that the Jal Jeevan mission brings the water supply to the entry point of the village, and after that, it is the responsibility of the Gram Panchayat or the community to ensure that water reaches the households. So, do all villages, are all villages interested in uptaking the Jal Jeevan mission water supply? I mean, what if some of the villages, like, they are happy with their existing situation and they do not want to uptake, building new pipes or building new taps, or they do not want to contribute to this scheme? I mean, have you faced any such issues?
No, I think I didn't communicate properly. Even the in-village infrastructure is also funded by Jal Jeevan Mission. It is not left to the community. The community is asked to pay only 10%. So when I said that the water will be taken up to the entry point, wherever we have designed MVS, the multiple village water supply systems from surface water, there we have designed to take that water up to the point. On the other hand, same Jal Jeevan money is also given to the village community to build in-village infrastructure. So the entire infrastructure is funded by JJM, whether it is in-village or the bulk water supply. And therefore, we haven't come across, we have come across some of the villages who have told us that they don't want additional investment, they don't want to put in that 10% also, because the current service level in their village is adequate. So we find that it is not as if that every village has a drinking water problem. There are villages which may not have a drinking water problem. So there we were not really forcing it upon them. But there are some places where people are resisting that we don't want it at the household level. Because if you don't give water connection to the household, the alternative is to go to a public stand post, which may be about 10 meters, 20 meters or 50 meters away from the household. Generally, my experience is that I visited hundreds of villages when implementing them. When you go and talk to the men in the village, they say that you are digging up my roads, don't do this, we already have good water. But when you speak to the women, they say that we prefer the water is there at their entry point. So those resistance are there here and there, but largely people have welcomed this. And the systems, piped water supply systems were there in many villages earlier, but they had suffered from various problems. Particularly there was an equity problem because the entire village was not getting the water. Low-lying areas in the village were getting the water, the uplands were not getting. The vulnerable communities, sometimes they are the weaker sections, they have their colonies slightly away from the village. We often find that water probably was not supplied to those villages, to those localities in the village. So even if the connection was there, water was not going. So we have done a few things. That is, number one, we have standardized the size of the pipe. We have put a meter, and we have put what is called a flow control valve, which dispenses water at the rate of 10 to 15 liters per minute. And it is uniformly done to all the connections so that even the low-lying areas and the houses in the uplands both get the same water because of the flow control valve. And therefore, we find that equity, intra-village equity is something that has been achieved. And we have spoken to people, and then people say that now the water, that their pot is getting filled is little slow. Earlier it used to take half a minute, now it is taking a minute and a half, but everybody is getting water. So that is the...
Good.
Great,
Thank you.
thank you.
Arko?
Thank you very much for your impressive presentation. I think it is also a big achievement to give more access to safe water to the population of India. So I'm very pleased to hear this. I think you perhaps did not mention other beneficial effects. First, employment, because to do such a large works at a large scale, you need a lot of workers, and therefore there's also an economic benefit. But on the other hand, I'm questioning because Aquafrol, the company I work for, has financed fluoride removal installations, and there the tendering process was extremely slow. First, of course, due to COVID, but the Madhya Pradesh government was not capable to do more than 10 tenderings per year. But I think your scale is much higher. So how did you manage to do all the tendering in such a quick pace?
State capacities vary, and in about 2 years, we have managed to tender out and hand over contracts worth 30,000 crores, which is about 3.6 billion US dollars. The systems actually vary from state to state, and some states the approval processes are very long and tortuous, and in other states this is slightly more streamlined. What we found in Jal Jeevan Mission is that once we took up this project on a large scale, almost each one of the 30 states were implementing it. We found that contracting capacities, particularly for large drinking water supply systems, were inadequate. And we found that there was a steep increase in price of raw material, particularly pipe. In Karnataka and in most other states, we have gone for the default pipe that we use is SDP. Earlier, we used to use PVC pipes. We decided to go in favor of SDP pipes. They are long-lasting, they are flexible and easy to implement, but slightly about 25% more expensive than PVC. But when we started tendering out, we found, and that was around the same time that Ukraine war also came up, and then there was this big spurt in the prices of both pipes as well as steel. And steel is also a component in our MS pipes, because the hierarchy of pipes we use is SDP, and then we use DI, ductile iron pipes, and finally we use MS pipes for large diameters. And we had to suffer the consequence of a very large increase, a steep increase in price of raw material and contracting capacities. So because of contracting capacities, some of the states have suffered, and in Karnataka, we had problems. In some of our tenders have gone for multiple calls, 7th call, 8th call, 9th call, those kind of things. But despite that, we were able to award about 3.6 billion worth of contracts of large schemes, another 3.6 billion worth of in-village schemes in about 2 to 2.5 years. And our tendering of the in-village infrastructure was decentralized. The approvals was given at the district level, and the tenders were called at the sub-district level. So basically we use multiple authorities, 30 chief executive officers, which means 30 district water and sanitation missions could do their own tendering. We put some financial limits. Any work below 50 million Indian rupees was delegated to them. Because of this also we could do it more. Some of the states have not decentralized and delegated their approval process to the extent that we have done. That could be another reason. So yeah, I suppose I can guess these are some of the reasons.
Fantastic. I think there's probably dozens of questions. I think Mr. Athik will stay around, so I'm conscious of time. So maybe we should thank Mr. Athik for the presentation and congratulate him on all the amazing work. And then if we can shift gears, we will have to conclude a panel session. So if the panelists would like to take the stage, I think you know who you are. If you'd like to come up, then we can move into this section of the discussion. And this is where we're sort of looking at alternative financing sources into the rural water sector. And this partly links in with ideas, what we've heard from Mr. Chowdhury in the Bangladesh example of professional service delivery models. What Mr. Atik has mentioned is a utility approach to this, and they're both performance-based types of approaches. So we've got, I'll introduce the panelists as we get to their questions, just to be conscious of time. So you're all very warmly welcome. Thank you for joining us. What I'll do is I'll start with Dr. Duncan McNichol that you've heard from this morning, so I won't go into much of his details. But Uptime has been developing professional contracting models for a number of years now, and it would be useful to have your reflections on that experience. And I think just for clarity, maybe explain what a professional service delivery model is, and what's the experience of these results-based contracts, and how are they working? So if you would like to take that.
Thank you. With a professional service provider, you have a legal entity that can be contracted, held accountable, regulated for a larger quantity of infrastructure. So kind of like we've seen with the multi-village schemes or the safe panning model. And then with that, what we've seen with Uptime is that technically they're able to maintain a much higher level of infrastructure reliability. They can do preventive maintenance to make sure that infrastructure doesn't break. It's fixed quickly when it does, and this is vastly ahead of the status quo of the failure rates of infrastructure we see otherwise. With that as well, there can be a cost recovery model, so users can be paying for the service, and that can help to sustain it. A central challenge that we've seen with this is this operational funding gap, where particularly in rural and remote contexts, even if water users are paying for the service, there's often a gap between what they pay and what the full cost of delivering that service is through these professional models. And linking funding to address this challenge has been difficult historically in rural water, I think for a few reasons. One is that it's seen as risky if we're going to put money into these professional service models. What exactly are they going to deliver in terms of results? It's also seen as costly, particularly because we just haven't had good data on what level of subsidy could be needed in these contexts. And it's also seen as difficult because how do you contract with these different service providers? What are the legal, financial, institutional mechanisms that you use to do that? With Uptime, we've tried to address this by working with a group of service providers, first in Africa and then now more globally, to design these results-based contracts to address these issues directly. And by using a results-based model to issue effectively performance-based subsidies based on verifiable results. So after the numbers are confirmed, to issue these payments, to use a standardized contract design so that it can be scalable across different countries, contexts, service models, and to ensure that users are paying at least something for the service in most of these cases, so that we're trying to at least minimize the subsidy that's needed, and then also get a signal of the perceived value from these water users. And so this is something that we've been co-developing with these service providers, first in Africa, now more globally over the past few years. We've iterated on this. The working papers are available. And so now it's serving about 4.5 million people in Africa, Asia, and Latin America. But centrally, it's been a learning project to understand, how can we tackle these issues, to understand what results are delivered at what scale, to engage these professional service providers to deliver a higher standard of reliability at scale.
Okay, I think I'll come back to you, Duncan, if I may. Next, if I can turn to James Arriga from the World Bank, based in Kenya. A very warm welcome to you.
Thank you.
James has been doing a lot of the work. The World Bank's been interested in these approaches termed as payment by results, which is, I think, in the same family of what we're talking about here. And there's been a large program that James has been co-leading in the Horn of Africa. And I don't know if you could sort of reflect in terms of, what's been the progress there in terms of driving more sustainable, safe drinking water services through the payment by results approach?
Thank you, Rob. I think a good point to pick it up was what the Secretary had said, that people don't need infrastructure, they need infrastructure services. So I think traditionally, for the longest period of time, those who are familiar with how the World Bank deploys its financing, it's largely more input-based infrastructure financing, where the government comes up with a list, a procurement plan, list of goods, contracts you want to buy, you get the funding for that, and hopefully you build the systems and people will be connected later at the end of the 5 years. But I think in the last decade, starting with the pilot in Vietnam in 2012, the bank came up with this new instrument called P4R. If you're familiar with that, P4R is Program for Results, where financing only comes upon achievement of results. And the whole rationale or philosophy around it, if I may use the word, is that infrastructure fails because of the institutional disarray upon which you build an infrastructure. So the approach we do take in a P4R is we incentivize institutional reforms that will make subsequent infrastructure work. So at the early stages of the project, a lot of the emphasis on building the right institutions upon which you're going to put in the infrastructure. So what we are doing, we have 2 operations in the Horn of Africa. The one my cabinet secretary had mentioned, groundwater for resilience, looking at how do we sustain, service delivery out of the rural water supply infrastructure. So the way it's structured, that the county governments that are implementing the project, first of all, you have to define, the institutional system upon which you are going to build this rural infrastructure. And those who are familiar with the way we are approaching it, we are implementing it, is based on the social accountability triangle. Those who are familiar with that, where on one up here you have the state as the policy maker, the regulator. On the other side, you have the service users, and on the other end, you have the service providers. So it's the accountability relationship between these 3 parties to rural water services is what makes it work. And I think the challenge for the most part in rural areas is that there is normally no separation between the user and the service provider. The user is the service provider, so it's difficult to draw the accountability lines, and eventually the infrastructure fails. So the first institutional incentive that the program is financing is that the local government, the county government in Kenya, first of all has to establish how this structure will look like. So the county shows that it has formally adopted through its legislative assembly a stable social accountability system. The state is clear on its policy function and infrastructure development. There is a clearly appointed professional service provider. And the regulator in Kenya has, over the last 10 years, I see Engineer Gakubia is there, led us very well for over 10 years, did a lot of good work in developing the whole of that model. So the government is to implement that, and then, so a county does that. That is condition precedent before you get financing for infrastructure. So you show us where this the institutional system, where this infrastructure will fall in, then you get the financing. So that's the first level of result. Then the second level of result is, which is a departure from our prior operations, where we only end it at the infrastructure. For this case, we are sort of in a way upscaling some of the work that Uptime has done quite a lot in different countries, where in subsequent years of the project, you get an operational maintenance facility financing based on your show functionality of the systems installed. So for example, you show that you've kept in that year the system, the operator has kept the system operating 95% of the time, the proper records kept there, there's proper accountability for revenues generated for that. Then you get the subsidy gap between your revenues and the expenditures. So that's what we are in the early stages of doing that with about 21 counties spread at scale. So it's sort of scaling up a lot what Uptime Facility is doing to bring a totally different approach to sustaining rural water services delivery, which is an exciting departure from a very infrastructure focused deployment of development financing.
Good,
Yeah.
thank you. I mean, that was a really clear explanation. That was excellent. Thank you very much.
Yeah.
If I could follow up with one short question. I mean, I think what we've heard from the experience from India and Bangladesh, government leadership in this is quite critical. So I don't know if there's any reflections in Kenya or some of the other Horn of Africa in terms of, you know, the conditions under which governments, national governments or subnational governments are engaging in this process. I mean, do they see this as an opportunity? Are they reticent? I mean, what's your sense in terms of government engagement with this approach?
I mean, from the conversations you have with the government, it's much easier to deploy such a model when it's anchored on some sort of existing narrative for change. For example, in Kenya, there's a very strong approach to performance contracting at a macro level. You know, the president has performance contracts with his ministers, the governors have performance contracts with his executives, the managing director of the water company has performance contracts with his staff. So it's much easier to introduce a performance-based approach when you have that sort of background performance thinking. So this brings it more to at the service delivery level, where we know that, you know, the president and his ministers have these agreements on policy outcomes. How do we cascade that between the service providers, the local government, and the communities and the service providers? So that drives a lot of the acceptance around it. But also the other thing we see driving it is the county government are very fiscally stressed. You know, it's not easy to finance a lot of the post-construction operation and maintenance costs. And a lot of the subsidies that goes into it are very poorly deployed. It's not based on any data. You really do not know what level of subsidy which system needs. So when you sort of enhance the accountability mechanism in a proper structure for service delivery where there's proper record keeping, the promise of that the next time this community is going to ask me to buy their spare parts, I have a data reference point. I have some compacts we had signed with you. This is the amount of revenues you collected. How much did you use? So what is the gap? How it sort of helped the government itself to smartly deploy, you know, the subsidy gap. So I think the promise of that I've seen to be a big incentivizing factor for the county governments towards, you know, accepting more of a performance-based financing mechanism.
Okay,
yeah.
Perfect. Thank you. So if we could turn now and welcome Iris Braun from Share, who's the co-founder and the Chief International Officer. So Share, I think you'll explain a little bit about the company, but it's a fabulously successful ethical company based in Germany that we have had some collaboration with in Kenya for a number of years with a very innovative one-to-one matching model to allow a sort of transfer of funds. So, I mean, Iris, a very warm welcome. Would you like to explain a little bit more about Share and the work that you're doing?
For sure. Thank you, Rob. So yeah, as you already mentioned, we're a social enterprise. We're based in Berlin. And what we do, I actually brought along some of the products to make it more tangible. So these are some of our products here. We sell consumer goods in supermarkets, drugstores, and other outlets in Germany, in Austria, Switzerland, the Czech Republic, Spain now. So we've expanded quite a bit. Such as this water bottle, which I was told I need to say that it's 100% recycled and recyclable, seeing that all of you are very conscious about waste issues as well. And then for each of these products, an equivalent donation automatically gets triggered, sometimes locally. So we have projects with local food banks where we supply one meal for each of the food products. And then we have projects like the one with Fundifix in Kenya, where we guarantee our customers that they will contribute to 1 day of drinking water for each of the bottles, each of the beverages sold. And you can track on the bottle where this donation reaches. Now, this level of transparency that we're promising to our customers, of course, needs to be matched with an equivalent level of transparency with our social partners that we're working with, such as Fundifix. So when in 2017 we came across the work that Fundifix and others are doing, and now Uptime is also expanding to other areas, we thought this is a perfect match because to promise our customers something, we want to obviously be sure that we can keep this, and the results-based contracts are giving us exactly this opportunity to have this transparency and traceability to ensure that we can keep our promise. So for us, it was a very good way to deliver that same tangibility and transparency to the customers, as well to have this transparency, accountability in our relationship with Fundifix. So to date, to give some numbers as well, we've contributed over €500,000 euros to projects with Fundifix, delivering over 15 million days of drinking water. So at least 20 liters is what we promised to our customers, and reached around 70,000 people that are under the scheme of Fundifix, and that get reliable water access. Now, of course, many funders, also private sector funders, prefer to have pictures of infrastructure built, wells dug, maybe pipe schemes. So if, in the absence of this, it's really important for us to be very tangible of what we can supply. And I think the results-based contract is also helping with that we can really pinpoint, we're not showing you a new well every week, but we can show you, we can promise you exactly how much it is that people will reach. So this has really been a perfect match, and I believe it can be expanded to many more areas and hopefully many more partnerships as well.
Okay, fantastic. And I have one just quick follow-up question in terms of other companies. I mean, you're sort of quite leading in this area, and I think Duncan will talk about other corporates as well. I mean, what do you think are the factors that will motivate or constrain other companies to engage in this space? What's your sense on that?
Yeah, so I mean, I've mentioned the word now several times about the tangibility, what motivates companies in this. I think I really very much enjoyed, Mr. Atik, the presentation of the fantastic results that you already achieved. I also very much enjoyed having the video at the start of the presentation, because it delivers a level of emotional connection that companies are looking for when they engage with their customers, to make really clear what is the impact that you as a customer, in our case in Germany, but potentially in many other countries, can have with your purchases. So this makes it a lot easier than, very vague promises such as we'll give a certain share of our profits, or, even if you say we'll donate $1 for each product, I mean, what does it actually mean? What does it do for people? What's my personal impact? I think that holds a lot of promise for companies. There's also, of course, a certain amount of de-risking that is happening for other corporates to have those results-based contracts. This is what motivated us as well. But I think generally this is something that can help to drive away skepticism around development work. So that I also see as a definite advantage. And I also, by the way, believe that this could be interesting for public, for handing over, transferring to public funding, because as we heard here before, also, if there's vagueness around how much does it cost, what do we reach, how does it work, will it work, if there is private sector funding coming in to get started and to work successfully on results-based contracting, I think the picture also for potential follow-on with public funders becomes much clearer. So I hope that also, and we've been hoping this, of course, when we started the program, that there is also interest from the public side to then take over after it's clear what the costs and risks are. Perfect. I mean, that's a perfect segue if we can turn to Kia Riddell, who's a program officer at the Konrad N. Hilton Foundation. So as many of you know, the Hilton Foundation has been a long-term and very generous supporter of safe drinking water, particularly for the most in need. I think as a foundation, there's sometimes some flexibility. But I think the question I would ask is in terms of, with that flexibility, how does it allow you to leverage your grant making in this area?
Great, thanks. And I know I'm standing between everybody and post-conference drinks and socialization, so I'll try and keep my remarks a bit short. But I think everyone here is aware of the substantial funding gap that exists in the water sector. So the Hilton Foundation works primarily in 3 countries, Ghana, Ethiopia, and Uganda. We recently commissioned a study that mentioned that in all of these countries, hundreds of millions of dollars are needed annually to be able to meet targets for rural water supply. So when you see those huge numbers, philanthropic funding is just a drop in the bucket. So many foundations, including the Hilton Foundation, think a lot about how to pursue opportunities that can catalyze larger scale and longer term changes, and also think about how we can leverage our funding to help organizations get access to more funding. So many foundations, including the Hilton Foundation, have a comparative advantage over other funders of flexibility and an appetite for risk. So we're able to provide funding towards innovative ideas that could be seen as risky and have a potential for failure. So we're willing to fund ideas that carry risk, because even if a project we fund fails, we might not necessarily see it as a failure if those lessons can be shared with the broader sector, and if others can learn from these failures. And then on the other hand, if a project that we fund succeeds, then obviously that's fantastic. And we have sort of established a proof of concept, and hopefully our funding was able to de-risk this innovative idea. And then now that this risk is less, then hopefully new funders can come in with additional funding. And so just a couple of examples of how we're doing this. So the Hilton Foundation is providing funding to a number of water service providers and professional maintenance providers. And many of these are currently based on subsidized arrangements, and the operators are unable to cover the costs of service provision from tariff revenue alone. And so some of these will likely need to be subsidized forever, but some might be able to eventually achieve cost recovery if they're able to achieve the right scale or improve operational efficiencies. So funders can, so foundations can try and help de-risk these water service providers through providing grants to help these water service providers scale up, or also to be able to improve their operational efficiencies. Also, many funders can try and improve creditworthiness of these water service providers by providing loans, maybe with zero interest or with low interest, and with very flexible repayment terms. And so if they're able to build their creditworthiness, then they'd be able to access other pools of funding, including from development banks or from commercial financiers or impact investors. And then there's also some service providers that will likely never be profitable due to serving remote geographies or working with customers that have a very low ability to pay. So you've heard a lot about uptime already. But Hilton was an early funder of uptime, and we've always been excited by this approach. And so I think the Hilton Foundation was able to provide funding to help address, to help uptime refine their data and analytic processes, and also to be able to pilot and scale up results-based payments. So now that they have their data systems in place and sort of a proof of concept that the results-based payments are working, Uptime's been able to approach corporate partners as well as governments to fund result-based payments, which, all of these, I think, government corporations, is just a very new way of funding that's probably more sustainable than relying on traditional philanthropic dollars.
Fantastic. Okay, so we'll go to questions just in a second, but maybe at that point, Duncan, maybe that's the segue into the corporate funding for Uptime, if you'd like to give us an update on that.
Sure, I think that was exactly it. When we were first testing this out, we needed support from Conrad and Hilton Foundation, other funders who are in this room, to try this out. Once we have more of a proven model where we can show what volume of water is produced, that it comes from reliable infrastructure, we have contracts with service providers all over, it's a completely different conversation to go to, for example, a corporate funder and say, here's what your money can deliver, the risk profile is different, the cost is clear, the results are transparent. And so we're starting to see the beginnings of that type of engagement. Earlier this year, Apple announced their funding commitment with the Uptime Catalyst facility, and I'm pleased to announce that just this week, we signed an agreement with the Coca-Cola Foundation, who is also coming into these results-based contracts. It's, I mean, it's still early days, but I think a central idea behind the project was if we could change the risk profile, if we could show what's delivered, that it is affordable, that it's generating real results, that we could bring in new sources of money into this tricky area of rural water service sustainability from corporate sources, from governments who can participate in this. And so it's exciting to see the beginnings of that.
Okay, fantastic. Well, maybe we'll turn to the audience. I know it's late. We did start a bit late, so thank you for being patient. Maybe we'll just take a round of questions. So if you've got the appetite, put up your hands, and we can take some questions. It is late in the day, I'm aware. All right. I think we've exhausted everybody. All right. We're going to stick around, so there'll be an opportunity to engage. It will be dinner at Keble College at 7 o'clock. But before then, we have an opportunity for a guided tour, which I'll explain in 2 seconds. But first, if we could give a big round of applause to our panelists. They will be around, so please continue the conversation, and thank you very much to all of you. Thank you.